This demo is about Zoeticx Patient Clarity Platform ability to support care collaboration between multiple care providers from diverse geographic locations. It focused on how patient care documentation flow in interaction between the care provider. The same ability is required by CMS for elder patients age 65 years and older with at least 2 chronic conditions. CMS requires that the CCM care plan must be available 7/24 for access from the primary care provider to any other care provider. Let's set the stage for the demo. Patients sign up with the primary care provider for CCM services. Primary care provider creating a care document available to be shared with other care providers. In this demo, we will use the progress note document from the ICU in lieu of the CCM care document. Now, the patient traveled from New Mexico to California. Unfortunately, he or she encountered a medical condition that need immediate attention from other care provider in California. In this diagram, the other care providers would access the care documentation made available from the primary care provider. You will see in the demo that patient consent will be required to add security to the overall scheme. Furthermore, we will demonstrate the ability beyond CMS requirement for CCM. It is the bidirectional nature of the care collaboration supported by a streamlined workflow process, removing all potential fallout omissions as well as manual process intervention. Let's start the demo. I'm now using the iPad to fire up an existing application and creating a progress note document from the primary care provider. Note that I have put a certain number of medical conditions as a reference point. Now that you see the progress note. Also note that the primary care provider resides in New Mexico. His practice may deploy a totally different EHR system than other care providers accessing the document. Say this is the Athena Health for the primary care provider at the base. Patient now is in California and seeing another doctor due to a newly developing medical conditions. The doctor now signed up to a website unique for CCM services for all New Mexico patients. Upon logged in, the doctor now searched the patients and found a match. Note that this website has no patient medical record store. The doctor now requests for patient consents to access the care document. Please note that the other doctor has no idea that the EHR system at the primary care provider is Athena Health, nor require any training to learn about Athena Health EHR system. The system now sends 4-digit code consents to a patient mobile device. The patient needs to give this 4-digit code to the doctor as his or her consents for documentation access. This consent is a one-time security token used behind it. Now the doctor retrieve and examine the care plan made available from the patient primary care provider from New Mexico. The document is generated on demand from the primary care provider systems. There is no duplicate copy at the other care provider locations. Up to now, it is a one-way collaboration that you have seen. The primary care provider makes his or her patient care plan available for read access. I would like to note that the care documentation represents the control from the primary care provider on what to share and not all the patient medical records in his or her EHR system. The second security control is the patient consents on who to share that particular document to. The doctor in California can also providing a summary of the visit back to the primary care provider. By submitting the summary, the system will now send a notification back to the primary care provider in New Mexico about the treatment procedure his or her patient received in California. Let's submit the summary now. Note now that the iPad on a primary care provider receiving a notification that his or her patient has an external documentation to review. Let's fire up the application. Under the To-Do activity, the primary care provider gets the summary of his and her patient visit in California. Not only that, let's see if the documentation is denoted in the patient record. This particular application, besides updating the actual document in the EHR, also denote if the note has been made on the patient timeline. Here it is. What you've seen is the ability to have bidirectional documentation flow. You may use the same framework for referring from a patient from an emergency room to a behavioral health services as an example. This same applies for CCM service involving patient care provider and other specialists like mental health.